This patient was referred to me for evaluation of tooth number 14. There's a crown on the tooth. Patient admits about a year ago he had issues with this tooth and was referred to an endodontist. He canceled the appointment to go see that endodontist when patient says suddenly my pain went away. And patient states everything was fine until a few days ago when a severe toothache woke him up in the middle of the night, and pain was pretty bad. So he went and saw his dentist, and his dentist referred him to us for examination. So that's what happens when you don't get the root canal done, when the nerves, the pulp tissue is still vital. At the time, the success rate a year ago, when the pulp tissue was still vital, was about maybe 90% or more. Now, if you look here, now there's an infection, so the success rate is about 80%. Now you can see infection, periapical lucency here and here. So now, a year ago, the success rate would have been 90% plus. Now the success rate is about 80%. So told the patient that, went over his options. Either we can try to see if we can save the tooth for you. RCT, I would have to go through your crown. You may need a new crown. Do the root canal for you, come back and see me 6 months later. If the infection is gone, great. If you still have the infection, then I'll give you two options. Either we try to redo the root canal and see what happens then. Even then, I can't guarantee success 100%. Or you can choose to have the tooth extracted. And patient said he wanted to try the root canal. So we're going to have him come back so we can do the root canal on this tooth. But listen to your dentist. When we refer you, or the dentist refers you to an endodontist, get the root canal done then, because the success rate would then be. This patient was referred to me for evaluation of teeth number 12 and 14. So this is the story, okay? Patient says 2 years ago, an oral surgeon extracted tooth number 13, okay? And according to the patient, the oral surgeon told him everything went well and there were no issues. But patient says after the tooth was extracted, she would get flare-ups in the area of the extraction. She would go to the oral surgeon, and the oral surgeon would basically put her on antibiotics and say everything's okay, just give things some time. And 2 years has gone by, right? The extraction of tooth number 13 was done 2 years ago, according to the patient. And every time she gets a flare-up, she goes to the oral surgeon, same oral surgeon. The oral surgeon puts her on antibiotics and dismisses her. Patient says she even was referred by the oral surgeon to a infectious diseases specialist. And this area was biopsied, and the result of the biopsy was inflammation or infection or something like that, local infection. And the infectious diseases specialist also says, well, I don't see any problems here, nothing like cancerous or metastatic or anything like that. This is just it looks like an infection there in that area. So she's been under the care of the same oral surgeon who extracted tooth number 13 and an infectious diseases specialist for the past 2 years. And every time, again, she gets a flare-up here. She calls it flare-up, swelling, and all that stuff. She goes to the oral surgeon, gets antibiotics, and gets dismissed. And this last time, patient says the same thing happened, swelling, some discomfort. She went to the oral surgeon, and the oral surgeon says, everything looks fine. This infection could be coming from the adjacent teeth. So go back to your dentist and have your dentist examine the adjacent teeth, or have your dentist refer you to an endodontist, because this could be coming, this area, this problem could be coming from the adjacent teeth. All right. So patient goes back to our general dentist, and the general dentist refers her to me for examination of teeth number 12 and 14. Now, as she's telling me all of this stuff, none of that stuff makes sense to me. That why an oral surgeon would do something like that or say something like that, when clearly it looks like, based on just my multiple angulation PAs, that this periapical lucency is associated with the area of the extraction of tooth number 13. The other thing that I was looking at this PA, I was like, the oral surgeon never bone grafted this area. They might have bone grafted it, but and bone graft kind of got destroyed by the infection. I don't know, but when I asked the patient, I said, did the oral surgeon bone graft this area after the tooth was extracted? And the patient said no. There was no, and she said she would know, because if it was, there would be a charge and all that stuff, and there would be a fee, a charge. And anyways, that's what we have. Okay, so I went ahead and this is what I saw. Take a look here. So as you can see now, that's tooth number 12, and tooth number 14 would be here. Look at this. There's a huge concavity. So the whole buccal plate of the maxillary jaw, the whole buccal plate is gone, and now there's a huge concavity. And take a look here. There's a sinus tract right there. And here it is. Tooth number 12, tooth number 14. And look at that. Look how much bone destruction has occurred there. And that's the sinus tract right there. Let me show you again, right there. Look at that sinus tract right there. And the destruction of the buccal plate, the concavity that has caused. And that's another, take a look here. That buccal plate is just destroyed. Huge concavity there. And there is a sinus tract right there. So teeth number 12 and 14. Examine both. Percussion within normal limits. Palpation within normal limits. That's tooth number 12. Let me show you tooth number 14. That's tooth number 14. PA's all within normal limits. Vitality, did cold test on number 12 and number 14. Both responded within normal limits to cold. Number 12 within normal limits to cold. Number 14 within normal limits to cold. It's clearly the area of extraction of tooth number 13. So I have no idea what this oral surgeon is doing. I have no clue. So I wrote a report to the dentist and requested that the dentist please refer this poor patient to another oral surgeon. Another oral surgeon. I'm begging you. This has gone on too long. This has gone on way too long. This patient, poor patient, has been suffering for the past 2 years. So I think what needs to be done is that this area needs to be surgically accessed, of course, flapped, surgically accessed. This whole area needs curated and irrigated and curated copiously and thoroughly. This area needs to be, and of course, some of the even the healthy bone, not only the area, the affected area, but also some of the healthy bone around it, around this area here. All of that needs to be cleaned out, needs to be curated, and a good amount of bone graft needs to be placed there. Good amount of bone graft. Hopefully that buccal plate could also be regenerated. With a good oral surgeon can do that. A good oral surgeon can do that. All right. So that's what we're talking about here. So this issue, this problem is not tooth number 12. It's not tooth number 14. It's the extraction site. It's that this infection, basically, once tooth number 13 was extracted, this area never healed. So, and you saw the clinical photo of this area as well, with the sinus tract and how much buccal bone destruction that there was there. So I requested that the general dentist refer this patient to a capable oral surgeon ASAP, so this area, this infection could be addressed once and for all, and hopefully that buccal plate could also be remade